Neck pain is a common complaint that can arise from a variety of causes, such as muscle strain, poor posture, or even stress. Many people experience neck discomfort at some point in their lives, and it can range from mild stiffness to severe pain that limits movement. Over-the-counter, or OTC, medicines are often the first line of defense for managing this type of pain. However, it's important to understand which medications are available, how they work, and who should avoid them. In this video, we'll explore the most commonly used OTC medicines for neck pain and highlight important safety considerations. OTC medicines are drugs that you can purchase without a prescription. They are widely available in pharmacies, supermarkets, and even online. These medications are generally considered safe for most people when used as directed, but they are not without risks. For neck pain, the most common OTC options include pain relievers and anti-inflammatory drugs. Understanding the differences between these medications can help you make informed choices about your health and avoid potential side effects or interactions. Acetaminophen, also known as paracetamol, is one of the most commonly used OTC pain relievers for neck pain. It works by blocking the production of certain chemicals in the brain that signal pain. Acetaminophen is often recommended for mild to moderate pain and is considered gentle on the stomach compared to other painkillers. However, it does not reduce inflammation, so it may not be as effective if your neck pain is due to swelling or injury. Always follow dosing instructions carefully to avoid liver damage. While acetaminophen is safe for most people, certain individuals should avoid or use it with caution. People with liver disease, heavy alcohol users, or those taking other medications that affect the liver should consult a healthcare provider before using acetaminophen. Overdosing can cause serious liver damage, so never exceed the recommended dose. Pregnant women should also check with their doctor before use. If you have any doubts, always seek professional advice. Ibuprofen is a non-steroidal anti-inflammatory drug, or NSAID, that is commonly used to relieve neck pain. It works by reducing inflammation, which can be especially helpful if your pain is caused by muscle, strain, or injury. Ibuprofen is available under several brand names and is effective for both pain and swelling. However, it's important to use the lowest effective dose for the shortest possible time to minimize side effects. Ibuprofen is not suitable for everyone. People with a history of stomach ulcers, gastrointestinal bleeding, kidney disease, or heart problems should avoid this medication or use it only under medical supervision. NSAIDs can increase the risk of bleeding and may worsen kidney or heart conditions. Additionally, pregnant women, especially in the later stages of pregnancy, should avoid ibuprofen unless directed by a doctor. Naproxen is another NSAID that works similarly to ibuprofen. It is often used for longer-lasting pain relief and can be effective for neck pain associated with inflammation. Like other NSAIDs, naproxen should be taken with food to reduce the risk of stomach upset. Always follow the dosing instructions and be aware of potential side effects, especially if you have underlying health conditions. Naproxen shares many of the same risks as ibuprofen. Individuals with a history of stomach ulcers, bleeding disorders, kidney or heart disease, or those taking blood thinners, should avoid naproxen or use it only under a doctor's guidance. It can also interact with other medications, so always check with your healthcare provider if you are taking other drugs. Topical pain relievers, such as creams, gels, or patches, can be applied directly to the skin over the painful area. These products often contain ingredients like menthol, camphor, or salicylates, which provide a cooling or warming sensation and help distract from the pain. Topical treatments are a good option for people who want to avoid oral medications or have sensitive stomachs. While topical pain relievers are generally safe, some people may experience skin irritation or allergic reactions. Avoid using these products on broken or irritated skin, and do not use them with heating pads, as this can increase the risk of burns. If you have sensitive skin or a history of allergies, test a small area first. Always wash your hands after application to avoid accidental contact with eyes or mouth. Some OTC products are marketed as muscle relaxants, often containing ingredients like methocarbamol or herbal extracts. While these may provide mild relief for muscle tension, their effectiveness is generally less than prescription options. Always read the label and be cautious of potential drowsiness or interactions with other medications. OTC muscle relaxants are not suitable for everyone. People who need to drive or operate machinery should be cautious due to the risk of drowsiness. Those with liver or kidney problems, or who are taking other sedating medications, should consult a healthcare provider before use. Pregnant or breastfeeding women should also avoid these products unless advised by a doctor. Some OTC medicines combine pain relievers with other ingredients, such as caffeine or antihistamines, to enhance their effects. While these can be convenient, they may also increase the risk of side effects or drug interactions. Always check the label for all active ingredients and avoid taking multiple products with the same components. Combination products may not be suitable for people with certain medical conditions, such as high blood pressure, heart disease, or sensitivity to caffeine. They can also interact with other medications, so always consult your doctor or pharmacist if you are unsure. Avoid taking more than one product containing the same active ingredient to prevent accidental overdose. Aspirin is another OTC pain reliever that can be used for neck pain. It works by reducing inflammation and blocking pain signals. However, aspirin is less commonly used today due to its potential side effects, especially in certain populations. It is important to use aspirin only as directed and to be aware of who should avoid it. Aspirin should be avoided by children and teenagers with viral infections due to the risk of Ray's syndrome, a rare but serious condition. People with bleeding disorders, stomach ulcers, or allergies to aspirin should also avoid it. Pregnant women and those taking blood thinners should consult a healthcare provider before use. Allergic reactions to OTC pain relievers are rare but possible. Symptoms may include rash, itching, swelling, dizziness, or difficulty breathing. If you experience any of these symptoms after taking a medication, seek medical attention immediately. Always read the label for potential allergens and consult your doctor if you have a history of drug allergies. OTC medicines can interact with prescription drugs, supplements, or even other OTC products. These interactions can increase the risk of side effects or reduce the effectiveness of your medications. Always inform your healthcare provider about all the medicines and supplements you are taking to avoid harmful interactions. Older adults are more susceptible to side effects from OTC pain relievers, especially NSAIDs, which can increase the risk of stomach bleeding, kidney problems, and high blood pressure. Lower doses and shorter durations are generally recommended. Always consult a healthcare provider before starting any new medication if you are over 65. Children should only use OTC pain relievers that are specifically formulated for their age group. Aspirin should be avoided in children and teenagers with viral illnesses due to the risk of Ray's syndrome. Always use the correct dose based on the child's weight and age. And consult a pediatrician if you are unsure. Pregnant women should be cautious with OTC pain relievers. Acetaminophen is generally considered safe in recommended doses, but NSAIDs like Ibuprofen and Naproxen should be avoided, especially in the third trimester. Always consult your healthcare provider before taking any medication during pregnancy. Breastfeeding mothers should also be careful with OTC medicines. Acetaminophen is typically considered safe, but NSAIDs and other drugs may pass into breast milk. Always check with your healthcare provider before taking any medication while breastfeeding to ensure the safety of your baby. If you have chronic health conditions such as diabetes, hypertension, or heart disease, you should be especially cautious with OTC pain relievers. Some medications can worsen these conditions or interact with your regular prescriptions. Always consult your doctor before starting any new OTC medicine. If you have a history of allergies to medications, always check the ingredients of any OTC product before use. Some pain relievers contain dyes, preservatives, or other additives that can trigger allergic reactions. When in doubt, consult your pharmacist or healthcare provider for guidance. Individuals with a history of stomach ulcers, gastritis, or acid reflux should avoid NSAIDs like ibuprofen and naproxen, as these can worsen stomach problems. Acetaminophen is usually a safer alternative, but always use the lowest effective dose and consult your doctor if you have concerns. NSAIDs can reduce blood flow to the kidneys and worsen kidney function, especially in people with pre-existing kidney disease. If you have kidney problems, avoid NSAIDs and consult your healthcare provider for safer alternatives. Acetaminophen may be used with caution, but always under medical supervision. Acetaminophen is processed by the liver and can cause liver damage if taken in high doses or for prolonged periods. People with liver disease or heavy alcohol use should avoid acetaminophen or use it only under strict medical supervision. NSAIDs may be safer for some, but always consult your doctor. NSAIDs can increase blood pressure and the risk of heart problems, especially with long-term use. People with heart disease or high blood pressure should avoid NSAIDs or use them only under medical supervision. Acetaminophen is generally considered safer for these individuals, but always check with your healthcare provider. If you are taking blood thinners, such as warfarin, you should avoid NSAIDs and aspirin, as these can increase the risk of bleeding. Acetaminophen is usually a safer choice, but always consult your doctor before taking any new medication to ensure it does not interact with your blood thinner. Some people with asthma may experience worsening symptoms when taking NSAIDs or aspirin. If you have asthma, consult your healthcare provider before using these medications. Acetaminophen is generally considered safer for people with asthma, but always monitor for any changes in your symptoms. People with diabetes should be cautious with NSAIDs, as these drugs can affect kidney function and blood pressure. Acetaminophen is usually a safer alternative, but always check with your healthcare provider before starting any new medication to ensure it is safe for your specific health needs. NSAIDs can raise blood pressure and may not be suitable for people with hypertension. Acetaminophen is generally considered a safer option, but always monitor your blood pressure and consult your healthcare provider before using any OTC pain reliever. Aspirin and NSAIDs can increase the risk of bleeding and should be avoided by people with bleeding disorders. Acetaminophen is usually a safer alternative, but always consult your doctor before taking any new medication to ensure it is appropriate for your condition. Some autoimmune diseases, such as lupus or rheumatoid arthritis, may require special consideration when choosing OTC pain relievers. NSAIDs can sometimes worsen symptoms or interact with other medications. Always consult your healthcare provider for personalized advice. NSAIDs are often used to treat gout attacks, but some people may need to avoid certain types due to kidney or stomach issues. Aspirin should generally be avoided as it can worsen gout symptoms. Always consult your doctor for the best pain relief options if you have gout. Some OTC pain relievers can interact with medications used to treat thyroid disorders. Always check with your healthcare provider before starting any new medication, and monitor for any changes in your thyroid symptoms or medication effectiveness. Certain OTC pain relievers, especially those with sedating effects, may interact with medications used for mental health conditions. Always consult your doctor or pharmacist before using any new OTC product if you are taking antidepressants, antipsychotics, or other psychiatric medications. Some OTC pain relievers can lower the seizure threshold or interact with anti-epileptic drugs. If you have epilepsy, always consult your neurologist or healthcare provider before taking any new medication, including OTC products, to ensure your safety. Some combination OTC products may contain antihistamines or decongestants that can worsen glaucoma. Always check the label and consult your eye doctor before using any new OTC medicine if you have glaucoma. Some OTC pain relievers and combination products can worsen urinary symptoms in men with prostate problems. Always read the label and consult your healthcare provider before using any new medication if you have a history of prostate issues. Some OTC pain relievers, especially those with sedating ingredients, can affect sleep patterns or interact with sleep medications. If you have a sleep disorder, consult your doctor before using any new OTC product to avoid worsening your symptoms. People with migraines should be cautious with OTC pain relievers, as overuse can lead to rebound headaches. Some medications may also interact with migraine-specific drugs. Always consult your healthcare provider for the best approach to managing neck pain if you have migraines. While OTC medicines can help manage mild to moderate neck pain, there are times when you should seek medical attention. If your pain is severe, persistent, or accompanied by symptoms such as numbness, weakness, fever, or difficulty swallowing, consult a healthcare provider immediately. These could be signs of a more serious condition that requires prompt evaluation and treatment. To use OTC medicines safely, always read and follow the label instructions. Use the lowest effective dose for the shortest possible time. Avoid combining multiple products with the same active ingredient, and keep all medicines out of reach of children. If you have any questions or concerns, consult your pharmacist or healthcare provider. In summary, several OTC medicines can help relieve neck pain, including acetaminophen, NSAIDs, topical treatments, and combination products. However, not everyone should use these medications, and certain health conditions require special caution. Always consider your personal health history, read labels carefully, and consult a healthcare provider if you have any doubts. Safe and informed use of OTC medicines can help you manage neck pain effectively and avoid unnecessary risks.